Hello and welcome to day 2 of week 2. If you remember from the day 1 video, I talked about chapter 34, which dealt with asepsis and how that process works. I also talked about some infection control processes and really what your role is when it comes to being a medical assistant with the asepsis role. So now for day 2, what I want to talk about is chapter 42 first and then chapter 35 at the end. So for chapter 42, what it focuses on is assisting with minor surgeries. So as medical assistants, there may be times that we're asked to help a provider during a minor surgery. Maybe that could be something as simple as a pap smear. So something that can be done quickly in the office without having to put the patient under any sort of anesthesia. So there are some specific ways that you as a medical assistant have to set up and get into a sterile environment to help with that minor surgery. So when you are assisting with a minor surgery, you will use surgical asepsis. If you remember from the day 1 video, I said that a surgical asepsis is really that sterile technique. That means that no microorganisms are present. They've all been destroyed and killed off during that sterilization process. You will also use a surgical scrub, which is very different from the medical aseptic hand washing that we learned how to do on day 1. So you will also have to use a sterile equipment and set up a sterile field. So when you're performing a sterile surgical scrub, first thing you want to do is you're going to remove all your jewelry, you're going to remove lab coats, and you're going to roll up any long sleeves that you have. You really want to roll them up past the elbow, okay? You want to use warm water, and here's the difference. In a medical aseptic hand wash, your hands are down. In surgical, they're actually facing up. So you have the water run from fingertips to elbow. You want to lather up each hand individually and all the way up to the elbow, making sure you get in between the fingers of the crease, front of the hand, back of the hand, and each hand should take about 5 minutes per scrub. Once they're thoroughly scrubbed, you're going to rinse them again from the fingertips to the elbow so the water runs off the elbow. And you always want to try to dry them immediately, and once you are immediately dry, you need to actually go into putting on some sterile gloves. Remember, your hands in a sterile scrub, once you're surgically scrubbed up, they need to stay above your waist. If your hands drop below your waist, they become contaminated and you have to re-sterilize the whole field. Okay? So now, our hands are washed and we're ready to put on our sterile gloves. So the first thing you want to do is always place your sterile gloves on a flat surface, that package on a flat surface. And you can only touch the outside 1-inch border. Everything in the inside of that 1-inch border is going to be sterile, so you want to keep that sterility. You always want to glove your dominant hand first because, well, it's your dominant hand. That makes sense. You do not want to touch the outside of the glove. There will be a folded up cup. That piece you can touch with your non-sterile or non-gloved hand because that's where your hand will be going into. It's the inside of the glove. Okay? Now, once that hand is sterile, it cannot fall below your waist. In order to put the glove on your non-dominant hand, what you'll do is slide your hand into the cupped piece of the glove and then take your gloved hand and kind of tuck it under that cup to help pull that glove onto your non-dominant hand. Once both gloves are on, what you'll do is you'll actually pull them all the way down over your lab coat cup so that way there's no break in that sterility. So for chapter 42, I want you guys to go ahead and review procedures 42.1, 42.2, and 42.3 before you come to class on day 2. And that's all I'm going to talk about for chapter 42. It's a real short version of 42. So let's move on to chapter 35. And this chapter, it's an exciting chapter. It's getting to the hands-on stuff now. You guys are going to start learning about vital signs. So vital signs are really the full responsibility and the biggest responsibility of medical assistants in the healthcare setting. Vital signs are really able to give your provider kind of a quick overview and a quick snapshot of how that patient's body is functioning and if it's functioning properly. There are 6 main vital signs that medical assistants are responsible for: weight, height, temperature, pulse, respiration, and blood pressure. So let's talk about each one of those kind of individually. So let's start with weight. So weight is one of the first vital signs that you generally get for patients when they come into the office. It's really important that you do this in a private area so patients can keep their dignity about themselves. Weight is not one of those things that's really easy to get patients to step up on a scale and do, because everyone does have body image issues. So please make sure you always do this in a private setting. Generally, you're always going to have your patients remove their shoes and any heavy outerwear that they're wearing, like heavy jackets or heavy sweaters, because this does alter the weight for the patient. Now, if the patient does not want to take off their shoes, or they don't want to take off their, their sweater or what have you, always make sure that when you document their weight, you put in there that they left those items on so the provider knows why there was a change in the weight. The other thing that's really important when documenting weight is you always want to make sure it says in pounds, or LPS, LB, B as in boy, S. Alright, so then we're going to talk about height. So height and weight are generally taken together because in order to get an accurate and a true height, your patient has to have their shoes off. Kind of why those two are always done together. When you do this, your patients should have their feet, or the back of their heels, their buttocks, and the back of their head touching that the measuring stick or the wall, however it's set up, because that helps them stand up as straight as possible. And then you're going to take that L-shaped beam, and you're going to place it on top of their head, not on top of their hair. That's the important piece here, because women generally sometimes have their hair up on top of their head. You want to make sure that you press it down until it hits the top of the patient's head. And then you'll be able to record the patient's height in inches. Generally, you won't put it in feet and inches because some measurements are taken off of height and weight. They calculate your body mass index, and that has to be in inches. So always make sure that you're documenting in inches. Temperature is vital sign number 3, and this is kind of helping to see what the regulation is for your body. Our bodies are pretty good about self-regulating, and this is where temperature comes in to see if we're able to do that. Normal body temperature is going to be about 98.6 degrees Fahrenheit. And generally when you do record a temperature, it is in Fahrenheit, but you can do some in Celsius. There are 5 main locations that you're going to be able to take temperature from: oral, or from the mouth; rectal; axillary, which is actually under the arm in the armpit area; aoral, which is for the ears; and temporal, which is actually across the head to the temporal membrane. Body temperature will generally be the lowest in the morning, and then it rises throughout the day. But some other things that can affect a patient's body temperature are going to be their age, gender, physical exercise, emotions, pregnancy, environment, infection, medications, and certain types of food or drink. Pulse is the next vital sign that I want to talk about, and this is really the number of beats your heart beats per minute. What it is a pulse is kind of a wave of the blood that comes from the body when that left ventricle of your heart contracts and then relaxes. An average pulse for adults is anywhere between 60 to 80 beats per minute. And the most common site that you're going to take a pulse for your patients is going to be on their radial artery, which can actually be found on your wrist on the thumb side. Okay? If you take your index finger and your middle finger and you run that down your thumb, just past where the wrist bends, and you press down, you should feel a pulse. That's where you will take a patient's pulse rate. You're generally going to take it for 1 minute or 60 seconds. And when you do this, there's a ton of factors that can factor into how a patient's pulse is. It can be based off of their age, their gender, their exercise habits, their size, physical condition or disease condition, medications, and things such as depression, anxiety, anger, fear, all of those actually play a role into how your patient's pulse will be. Respirations is the next vital sign I want to talk about, and really, just like height and weight, pulse and respiration should be taken together. And respiration is the act of breathing, so one inhalation and exhalation. So breathe in and out, one breath. Okay. Respiration rates really indicate how well your oxygen is being provided and moved throughout the tissues of your body. The reason I say that pulse and respiration should be taken together is if I were to say to my patients, okay, I'm going to take your respirations now, they alter their breathing pattern because they think I can't see it. So when you're taking a patient's pulse, what I generally suggest is do the first 60 seconds of pulse, leave your hand on the wrist, and then watch them breathe for the next 60 seconds. Because then they don't know that you've stopped taking their pulse. Their mindset is still here, when really your mindset is here, watching their chest rise and fall or their shoulders rise and fall. Okay. An average adult breathing or respiratory rate is anywhere from 12 to 20 breaths per minute. But just like any other vital sign, there are some different factors that can affect your respiration rate. Just like age, allergic reaction, medications, diseases, exercise habits again, fever, emotions, pain, shock, along with a slew of other different effects and factors that we have to think about. And the final vital sign I want to talk about is blood pressure. Now, this is the most important vital sign that you as a medical assistant will take. And the reason being is it really helps doctors to aid in a diagnosis and making sure that their treatment plan for the patient is correct. That's why I spend a lot of time teaching you guys how to do blood pressures, because it is so important. Blood pressures really consist of two different readings. They consist of a systolic and a diastolic number. A systolic number is going to be that first sound that you hear with your stethoscope. And the diastolic number is going to be the last beat that you hear with your stethoscope. So high number, low number. When you document a blood pressure, it's generally going to be in a fraction sense. So 120 over 80 fraction. Which is kind of funny because that happens to be the average or normal or optimal blood pressure is 120 over 80. Now there's two key pieces of equipment that you will need in order to take a blood pressure. One being a stethoscope, two being a sphygmomanometer, or a blood pressure cuff. You don't necessarily have to know how to say that. But just like any other vital sign, there are different factors that can affect your patient's blood pressure. And they're just like some of the others you hear. Age, gender, obesity, exercise patterns, emotions, diseases, shock, dehydration, anxiety, and the list goes on and on and on. Alright guys, that is all that I have for you for the Day 2 video. As always, I really hope that you guys have a chance to be able to read all of your chapters in full and come ready for all of the fun procedures I have set up for you guys. Have a wonderful week, and I will see you on Day 2.